Hi everyone, my name is Nikki and I am a public health intern for Seeds of Hope. And today I would just like to quickly go over sexually transmitted infections, or also known as sexually transmitted diseases. So specifically, we will go over different kinds of STIs, STI symptoms. We also want to go over condom safety and ways to prevent STIs and HIV. Now, it's actually really important to know that STIs can be caused by three different things: bacteria, viruses, and parasites. So, with bacteria and parasite STIs, they are actually curable if detected early, whereas viral STIs can be managed. So, some examples of bacterial STIs include syphilis, gonorrhea, and chlamydia. Viral STIs include genital herpes, HIV, and HPV. An example of parasite is pubic lice. According to the World Health Organization, or WHO, people who have STIs like herpes and syphilis are actually 3 times more likely to acquire HIV. Now, mother-to-child transmission of any kind of STIs could result in stillbirth, low birth rate or prematurity, sepsis, pneumonia, or even neonatal death. HPV infections cause over 500,000 cases of cervical cancer each year, with just over 300,000 cervical cancer deaths each year. STIs like gonorrhea and chlamydia are actually major causes of infertility in women, but also can cause something called PID, which is pelvic inflammatory disease. So it's actually really important to be aware of the symptoms and also use precautions whenever necessary. STIs are best caught early to lower the chances of long-term effects. Now, I just want to quickly go over the symptoms in women for each of these STIs, starting with chlamydia. Symptoms can appear within days or weeks and can include abnormal or strong-smelling vaginal discharge, swelling of the vagina, painful sex, and burning or painful urination. Now, just like with the previous one, gonorrhea, symptoms can appear within days or weeks and can also include painful urination. But with gonorrhea, symptoms can also include increased vaginal discharge, abnormal or pelvic pain, and vaginal bleeding in between periods. Moving on to genital herpes. Symptoms can also appear within days or weeks, and symptoms include painful or itching around the genital area, small white or red blisters, ulcers, or scabs. Now, with genital herpes, normally there's initial outbreak that occurs, and symptoms of that can include muscle aches, swollen lymph nodes in the groin, fever, or headache. Now, moving on to hepatitis B. Symptoms of this can actually most likely appear within weeks or months. Symptoms can include fever, fatigue, loss of appetite, nausea, vomiting, or what is called jaundice, which is the yellow coloring of the skin or eyes. And going on to syphilis, syphilis actually occurs in stages. So there's primary stage, secondary stage, latent stage, and tertiary stage. Now, with primary stage, Normally, sores appear at the site of the infection and usually are firm, round, and painless. Now, with the secondary stage, this is where people normally get a skin rash, swollen lymph nodes, and fever. And with the latent stage, this is important. Generally, it is asymptomatic, which means no signs or symptoms. And with the final tertiary stage, this is where severe medical problems occur. And syphilis in this stage can affect the brain, heart, or other organs. Now, finally, I just want to touch on symptoms of HIV. Symptoms can appear within weeks or months and can include fever, chills, rash, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. I just want to touch on condom safety. And it's really important to know that actually condoms have an expiration date. So it's important to not use a condom past its expiration date, and to make sure that the condom does not have any holes or looks like it's worn out in any way. You want to use new condom each time with each sexual activity, and never ever reuse condoms. Now, it's best to use latex condoms or external or what's known as male condoms have been shown to lessen the likelihood of transmitting STIs and HIV. Now, if you or your partner are allergic to latex, there are latex-free alternatives. Now, it's also important to know that not all STDs have symptoms. So it's important to have an open and honest conversation with your partner. And if you do have symptoms of STDs, you should talk to a healthcare provider that you trust, because female adolescents are at high risk of getting STDs. And remember that STDs or STIs are common and that you are not alone. And thank you for joining me today. I hope that you were able to take something away from this presentation. And most importantly, stay safe. Thank you.